Hi, everyone. Thanks so much for joining. Making Sense of Chaos, the impact of the pandemic on South Asians. I'm so excited to um, share the stage with many other colleagues who I'll be introducing in a minute. My name is Sonny, and I am part of Riyaaz Qawwali, an ensemble of musicians based in Houston, Texas. And we're very excited to be coming into this new space of using our music in a more active civic engagement angle sort of manner. Riyaaz Qawwali consists of many talented musicians other than myself, and I just happen to be representing them today. What we do is present devotional music of South Asia. Qawwali actually comes from Sufi Islam, but we also showcase bhajans, kirtan, and non-devotional music like ghazals. What we're trying to do is basically show a face of South Asian culture, poetry, music through our work. So Riyaaz Qawwali consists of many musicians that are all coming from different backgrounds. South Asia is very different. It is by no means a monolith, and that's the same with Riyaaz Qawwali. We have people in the group that are coming from different backgrounds and from different ethnicities, different languages that are spoken at their home. That may be their first or second language. And to me, that's the beauty of what South Asia is as well. It's not a monolith. And everybody that is and considers themselves Desi or South Asian comes from a perspective that's a little different. While Riyaaz Qawwali always tries to pull out what brings us together and what's the oneness that ties us all together, it's important for us to recognize that each of us has something unique and different that we're bringing to the conversation. With that being said, I am extremely excited about a new project, which is what's bringing me to do our first live session on YouTube in front of all of you. It is a arts and discourse where we would be using Qawwali and trying to tease out themes from that Qawwali and then talk about it as to how it relates to 2020, your life and my life today. And it's an interesting way to engage the artistic perspective and interpretation on current topics. We've been doing this at Riyaaz Qawwali for many years, but I'm excited to do it very directly, supported by Houston in Action. So the project, very simply, is to use the arts to spark a conversation amongst our community and really talk about topics that are important to us. So the project is something like this. There's our Qawwali with some visuals, creating a music video, and then talking about it in forms like the one we're going to do today. So the first Qawwali that was part of this initiative was just released on Monday. And if you go to our YouTube channel, you can see that. We'll try to throw a link down here as well. But that video is a Qawwali by Firaq Gorukhpuri. Aayi hai kuch na pooch Qayamat kahan kahan, uff le gayi mujhe mohabbat kahan kahan. And a beautiful poem, a ghazal authored by Firaq, and we put it in Qawwali format. And if you go into the lyrics itself, and you'll see the handout that goes into the translations. I'll share that in a moment. But if you go to the video itself, you can understand the theme of it. And visually, what we are trying to represent is a South Asian family going through the pandemic, going through a time of difficulty where one of the family members gets COVID, and unfortunately everything is not okay. So the obvious theme that comes out of that music video is healthcare, the pandemic. It's on everybody's minds. And what I'd like to do today as sort of an agenda is to look at the theme of healthcare from various perspectives. To help me do that, I'd like to invite on several partners of mine, but the first one is Nabila Mansoor. Nabila is very well known in the Houston community in Harris County, and she represents Emgage, Texas. And when we started this project, we actually brought on Nabila as well as OCA Greater Houston, and Coleen will be joining us with an introduction about OCA. But I'd like to bring on Nabila so she can introduce the rest of folks. Nabila, thanks so much for joining. It's a pleasure to see your face, even though it's a little later than we used to like to talk.
I actually really like doing a late evening. We're kind of done with the workday. We're talking about arts, but we're going to tie it to something that's really relevant, that's happening in all our lives. So excited to be here.
Well, we're very thrilled to be working with Emgage and looking forward to using the arts in that sense. So Nabila, I'll let you take over.
Yeah, thank you. Hi, everyone. My name is Nabila Mansoor. I'm the executive director of an organization called Emgage. We have chapters all across the country. We also have a chapter here in Emgage in Texas. And we're working really hard right now. As you can imagine, we're about 34, 35 days away from the election. This is our busy time. And that's because our organization is committed to making sure that South Asians, that Arabs, that Muslim community members are getting involved in the elections. They know what's going on. They're making sure that their voices are heard. And so when this opportunity came up to partner with an artist and something that is so dear to my heart, Qawwali, something that I grew up listening to in my household, well, I jumped at it. And the reason is simple. How do we get the message out to communities that maybe aren't open to that message? You know, the elections can kind of seem all-encompassing. They can seem overwhelming. And sometimes the disconnect of why they are important is a little lost. And so our job is to try to make that connection. And what better way to make that connection than bringing in a popular form of music that is very, very close to the heart of many of the people that are in the South Asian diaspora here in Houston, here in Texas, here in the United States. So we're very excited about this project. I think we're going to have a really great discussion. We have a great panel. It is my pleasure to introduce my good friend, Rafana Hussain. She is with an organization called Daya, and they are doing wonderful work. So I'm going to now hand it off to Irfana.
Hi, Nabila. Thank you so much for that introduction. And Sonny, thank you for having me on this panel. I'm really excited that Daya gets to be a part of this discussion. So just to introduce myself a little bit more, my name is Rafana Hussain, and I'm the Director of Outreach and Education at Daya. And Daya is it's a local organization here based in Houston. It was founded in 1996, and since then, we've been serving the greater Houston area community, specifically focusing on domestic violence and sexual violence. So we provide culturally specific services that are geared towards survivors from the South Asian community. And we do that through focusing on the barriers that the community faces, whether it's language, whether it's access to resources, people understanding their culture. And so we're really committed to not only creating safe communities and healthy families, but we also want to make sure that we partner with the communities in providing more access to the South Asian community in terms of resources and help. So thank you so much.
Thanks for joining. We really appreciate the work they do.
Yeah, thank you, Irfana. We also have a wonderful panelist from Shifa Healthcare. She is, by the way, amazing when she is in front of an audience. She's a constant speaker at our youth leadership program. I'm kind of a big fangirl. Dr. Uzma Iqbal. Mute.
Thank you very much. That's a very kind introduction, Nabila. Sonny, Nabila, and Irfana, thank you very much. I think this conversation is so important that you will wonder, like, Qawwali, Emgage, why is a doctor here? Of course, healthcare, but I think the connection is deeper and broader. To me, South Asia and art has been, kind of growing together, where we have used Qawwali and poetry and prose in extending messages for social well-being and social development for centuries, if not longer. So how I am involved in this, it's because pandemic has affected the health of our community globally, but locally also. And a South Asian community is definitely a specific community because it's more marginalized, it's underrepresented, and that just brings the gaps in getting healthcare, access to healthcare in the forefront. A lot of people don't have access, or if they have access, they cannot use it, or they don't have insurance. There are many barriers, like Irfana was talking about. There are many barriers to getting good healthcare. And on top of that, this pandemic has just traumatized and has caused an emotional injury and physical injury at so many levels. And I know that initially we were like all talking about this. There were a lot of education, but then it just died down. And I'm glad we are having this conversation. I'm also part of Shifa Healthcare. It is a nonprofit organization that provides free healthcare in 6 clinics. And 3 of the clinics worked and provided telehealth through the pandemic. So I'm more than honored to be part of this panel and look forward to a robust conversation.
Thanks for joining, Dr. Iqbal. We really appreciate it.
Thank you.
Coming up next, we have Coleen Lynn, who's been helping and been such a great partner with OCA Greater Houston. Really, it was Sonny that invited OCA and Emgage to originally get involved, and it's been a really fruitful partnership.
Hi, Coleen. I think you're on mute.
Sorry about that. Thanks for the introduction. Hey, everyone. Thank you for joining us today. I'm Coleen Lynn, member of the OCA Greater Houston team. We are a volunteer-driven organization of community advocates that strive to meet the current and evolving needs of the diverse Asian American Pacific Islander population through a comprehensive continuum of programs focusing on advocacy, education, economic empowerment, developing leadership, civic engagement, participation, and arts and cultural awareness. Learn more about our chapter at ocahouston.org. I'm honored to be representing OCA Greater Houston today.
Coleen, thanks so much. And we should mention that Coleen also is responsible for a lot of the amazing artwork that was attracting many of you. So, I have to give a huge shout out and thank you to OCA Greater Houston and Emgage. As an artist and new to this space, I came out with what I thought was maybe a crazy idea. And both of them, like with open arms, were like, no, let's do this. Where's the dotted line? And that's very heartening for an artist to hear, especially during this time. So Coleen and Nabila, thank you so much.
Thank you, Sonny. We all jumped at this opportunity because we know how important this is. So thank you for your leadership. So our final panelist is Riaz Siddiqui from the American Pakistani Foundation. And I am sure a lot of folks here in Houston are familiar with him. So would love to introduce Riaz.
Thank you very much, Nabila, Sonny, and Irfana, and Uzma, and Coleen. It's a pleasure to be with all of you. When Sonny asked me to be part of this, I did this out of a very mixed sense of purpose and mixture of emotions. Music and I go back many, many moons ago. I'm one of those rare individuals that grew up in Pakistan and dropped out of engineering school to be a lead singer in a rock band for 2 years. That was never done, in those days. Then I wised up and got back. So music and I go back a long ways, and I've enjoyed Riyaaz, Qawwali for the longest period of time, and I'm big fans. So when he asked, I had to say yes. But more importantly, the two emotions that I'm going to talk about when we're talking about this nation, this sense of making sense out of chaos. So in science and in Islam, there is the notion of the ultimate chaotic event. One is the Big Bang. 13.7 billion years ago, the Big Bang, science says, caused this nation to happen. And in Islam, that is reflected by the two words kun fayakun. He willed it and it was. So when I look at what we talk about as chaos today, in a relative sense, actually it's a continuum, a journey that started 30.7 billion years ago. We just happen to be inhabitants that are certain manifestations of that energy form that transpired 13.7 billion years ago, and we will convert ourselves into some other form. Now, the relationship of that to Qawwali is actually quite profound. Qawwali is also a manifestation of that same energy, except in as much as we are physical forms, it is a spiritual form. And that's why when Riaz Qawwali sings, whether you're Desi or not, if you give them enough time, they will have you enwrapped in their rhythmic sounds. They will have you exalted in a matter of minutes and seconds. So the two emotions that I'm really enveloped by, one is a sense of purpose for trying to help people that are truly dealing with this COVID crisis. I have friends who have lost parents. I mean, in one instance, I have a dear friend who lost his mother and his uncle, his mother's youngest brother, within 7 days of each other. Okay. I have a dear friend who is an ER doctor who was literally pronounced dead, and mashallah, he's back and he's okay. So I have personally been touched. I'm sure all of you have been touched. So there's that sense of purpose that there are people who are really hurting, and we need to do something to help them. But there's a second emotion that accompanies this sense of purpose, and that emotion is actually joy. And you'd be saying, but what is so joyous about it? You know what's so joyous about this? Again, going back to Qawwali. Qawwali is something that starts off very, very slowly, and then you find yourself wrapped around in this rhythm and these notes, and you find yourself exalted. Well, the sense of purpose that all of us are called upon to do is the same. So the joy is that we have a purpose for our existence today that actually nobody in human existence ever had. Humanity has never encountered a challenge like humanity is encountering today. So it's with that sense of purpose I come here today. I'm chairman of the board of the American Pakistan Foundation. It was established in 2009. The basic purpose of the organization is to build bridges of understanding between the people of the US and people in Pakistan. There's about 600,000 to 800,000 Pakistani Americans here in the US, and about 60% of them are under 40 years of age. So we have a very youthful population. And what we're trying to do is to provide them a platform from which they can participate in every aspect of American society to their fullest potential. So thank you very much for allowing me to express these few words, and it's my distinct honor and pleasure to be with you all.
Well, Riaz, you just elevated the conversation in so many ways. And I'm excited about teasing out some of these opportunities. So one of them you mentioned was kun fayakun, which is he willed it and therefore it was. And that leads me into the first thing, which is the lyrics of a Qawwali are so important, whatever Qawwali that may be. And this art form is has been exoticized to an essence about, oh, it's just got cool sounds, but the lyrics are so important. And so I'll springboard off of that to the Qawwali Riyaaz that we just did. And some of you may have watched it, but we released it on Monday, and it was by Firaq, Gorukhpuri. So what I want to do is translate a little bit of it, because everybody may not understand it, Urdu, that's joined us today. So, आई है कुछ न पूछ कयामत कहाँ कहाँ, आई है कुछ न पूछ कयामत कहाँ कहाँ, उफ ले गई मुझे मोहब्बत कहाँ कहाँ. Qayamat, sort of judgment day. Don't ask to what extent doom has come. Doom, or the judgment day, is upon us. My love has compelled me or taken me into new horizons and to new extents. Hosho Janu bhi ab to bas ek baat hai Firaq. And Firaq is, the author's name, which is a literary thing that's often used in Urdu poetry and Punjabi poetry as well. Hosho Janu bhi ab to bas ek baat hai Firaq. Hoti hai us nazar ki shararat kahan kahan. So Hosho Janu, reality and passion, have blurred into one. Their glance, as in his or her glance, and the glance's playfulness can be found to whatever extent you see, so can be found everywhere. The lyrics and Firaq's poetry in general was introduced to me by Dr. Akbar Haider at University of Texas at Austin, and it's beautiful, rich poetry, and I really felt that it was right to use it at this point. As I mentioned, if you have a chance to look at the video, it's actually a representation of a South Asian family, a core family that unfortunately does not do fare well after getting COVID. And, we made it with that sort of gravity and with that sadness, because it's happening to some of our community. So, I can speak about it being a challenge and very interesting to make a Qawwali during the pandemic, where artists are considered not essential, or when artists have specifically been told, like choirs have been told, hey, you guys are responsible for spreading, so stop singing in groups together. And so there are certainly challenges that come with that. But it was, because this is our blood, it was an honor to prepare it. I'd love to hear if anybody else got a chance to watch the video, if it was impactful to you, and what were your thoughts in that?
So I watched the video. I had a chance to look at the draft, and the thing about Qawwali is, Riaz Saab talked about it so beautifully, but for me, it's very simple. It just gets you. It gets you in the heart, and there's nothing like it. And then you kind of put that music and put this background story of a family that looks like a family that many South Asians would be familiar with. It brings a connection in a way that brings it home and makes it very real. And I think also the way it's filmed, using some of the subtleness in the Bollywood film is very familiar to a lot of us that grew up on it. So it was a real to watch it.
Thanks. Anybody else before we jump into the questions itself?
I actually saw it too, Sonny, and again, very moving, very touching. And I always try to find some purpose in any experience like watching that video. And you all did such a masterful composition of the Qawwali itself. So regardless of whether somebody understands the words or not, but the association of the words with the story, the narrative that is told, that young lady with that young child, with the husband, I mean, it gives sort of form to the words. Aayi hai kuch na puchiye qayamat kahan kahan. Qayamat meaning the doom, and Qayamat is not just doomsday, it's also an event of monumental proportions that one has to deal with. And so without giving too much away, I saw that lady succumb to the to the victimhood that the virus conveyed onto her, and then the Qayamat that happened to her child and to her husband. So I'm saying to myself, well, what should that move me to do? And I think in the same video, you see very interesting things like people putting on face masks, people doing hand sanitizing, social distancing. So one very sort of simplistic motivation that I get from that video is, hey, I have to be a little bit more conscious about that and take that message and convey it to my friends and family around me and to the larger community at large. But there's a second thing, which is in our nation, the only, and I mean the only way to make significant, monumental change is to follow the advice of Nabila and Emgage. It's to participate in these elections, because whatever we are doing as individuals, the only way to leverage that across millions, right? We're a nation of 330 million people, roughly 200 million voters. It's to participate in this democracy, get your voice heard, and to the extent that you're doing all the social distancing and mask and all that stuff, well, leverage it, enhance it by participating in these elections and encouraging all your friends, neighbors, people that you know far and wide to do the same thing. So I thank you very much, Sonny, for giving us such an inspirational video and composition. The composition is so lovely. Thank you very much.
Well, yeah, I appreciate it. That's so kind of both of you guys. And I think both of you, touched on or got what we were trying to deliver. So that's so makes an artist like me so happy. Both of you have brought up a really good point, which is the video is about the pandemic, and it's about healthcare, and it's about how it's impacting families. We can talk about the high level, the numbers, but it's also touching people. Fathers who are getting permanent heart damage, and mothers who are passing away, and children who are getting disease. So we really are honored to actually have Dr. Iqbal with us. So, Dr. Iqbal, I'd love to bring you into this conversation to understand the pandemic. It's certainly brought out disparities, health disparities. How are different communities dealing with COVID, and what are some trends that you're starting to see within the South Asian community?
So, Sonny, healthcare, as we know in the United States, one of the most advanced countries in the world, if not the most advanced country in the world, struggles. And we have had disparities even before pandemic hit. We have problem with access to healthcare. We have problems with people who are not insured. We have problems with people who are afraid to even gain access to healthcare because they are, whether they are undocumented, or there's a fear from a lot of conversation that goes around in the communities. So the disparity is multifaceted and it's multi-layered. But what you touched upon in your Qawwali, it transcends the society or the community, because pain and loss is hurting everybody the same. Whether you are South Asian, whether you are, whether you're white American or you're Black American, it just hurts the same. Loss is loss. But what makes it exaggerated are these disparities that we bring up, because people are not able to understand their rights. People are not able to understand how to go to get healthcare and how to access it. So they're not even going to the emergency rooms. I'm a cancer doctor. What I've realized now in the last 6, 7, 8 months is that there was a time when cancer screening was put on hold. So now we are seeing patients who have cancer, which is in much more advanced stages because they weren't diagnosed on time. And it's no fault of anybody's, but this is that Qayamat, which can manifest itself in so many different ways to so many people. So I think what it has done is it has allowed me as a physician, you as an artist, Nabila as a civic engagement, and Irfana and everybody on this call, Riaz, you and Coleen, to use our current position as a platform and then raise our voice and raise awareness from that platform. I'm no longer a doctor and I have nothing to do with civic duty or not, right? I mean, it is my responsibility to raise awareness. So in my clinic, I engage my patients in conversation because I think it's extremely important for communities which are underrepresented or not represented properly, because you could be part of a big bucket like Asian and then South Asian. But in South Asian, there are many different kinds of communities. So what happens is you get masked or hidden or not, you are invisible even if you are present. So in order for people to be seen for who they really are and what their challenges really are, we need to make sure that that bridge between the society and the public health and the civic organization is created, and from that we can just start this conversation, and we can start conversation to create awareness. And I think there's a lot of grassroots works that's happening, and a lot more is needed. So I mean, I'm sure we're going to continue to have this conversation and bring diverse ideas into it.
I think what you said, though, is so powerful because, a lot of us feel isolated. And here you are, you're essentially saying, yes, we're isolated. We're different people, different professions, but you no longer feel just as a physician. You feel sort of connected with Nabila's work, with my work, with Riaz Saab's work, with Irfana's work. And I think that's really interesting for us to be in isolation, yet have the opportunity to rise up and be more connected with one another, to encourage one another to come out. One thing I want to tease out, and I'd be opening the question up to everyone, is, the other part that the pandemic has hurt the group that we're not hearing as often within the South Asian community is the small businesses. So does anyone have an opinion or perspective on that front?
I know Riaz would, but I want to just chime in really quickly because I want to link it to the healthcare. What the issue that we are seeing at the front line, I think we can echo. Okay, perfect. So I think what we are seeing as a front line, that a lot of people who are in small businesses, they did not have the protection. Even if they did have insurances, they did not have the protection of continuing that. Like Cobra is extremely expensive. Right. And if you lose your insurance, then you don't have a way of getting it again. So a lot of people were furloughed, but now they are being laid off. So people, again, another level of barrier for getting healthcare, and this is actually causing a lot more than just physical health. It's mental health. It's increasing the closeness where we are all on top of each other, no way to express, and domestic violence. I know Irfana is going to talk about it. And just like small businesses, we wonder, like, why would pandemic increase, domestic violence? Why would small businesses hurting, bring domestic violence? Irfana, you want to talk about it? And then Riaz.
Yeah, it's definitely Uzma. So, in line with Sonny's question about, how small businesses are being hurt, with that, we saw many of our clients who are on the road to recovery and getting jobs to help support themselves and their families after fleeing violence. Many of them worked in the hospitality industry or at restaurants, at small businesses. And so they were definitely impacted, and trying to get some of our clients, financial aid, it has been a struggle, and we've been fortunate to get funding to help them with their basic needs. But, that uncertainty of when is the situation going to change? When am I going to get employed? The feeling of being let down, that there isn't a lot of options open to you at the moment. The government or local officials are saying, another month we're going to open up this, or another month we're going to open up that. But we don't know if that actually is going to pan out. And what does that mean for people who've been unemployed for so long in trying to get back into that? Many businesses are not able to come back out of such a long period of not being in business. And so those options become really limited for people who really need the money. Like, they're willing to work, but the options are just not there for them.
Great point. Riaz, I know you wanted to say something.
Yeah, go ahead.
Yeah, so small businesses are hurting beyond belief. The restaurant industry has been literally devastated. Okay, simple things like just look at yourself and see what frequency are you delivering your clothes to local dry cleaners and cleaners to. I can tell you what I used to deliver every week. Now it takes me 6 weeks to do. Why? Because I'm at home. I'm not using suits and this and that. Anyway, there is a immense impact on small businesses, and up to now, the stimulus that the Treasury provided, the stimulus that the Federal Reserve provided, helped us out. But this pandemic is far from over. It's far from over. So we need to be prepared to help out small businesses. And again, this is completely apolitical. I'm simply making a statement as an American citizen. This pandemic does not differentiate between Republican, Democrat, Independent, South Asian, Caucasian, nothing. So if it doesn't differentiate and your only barrier of protection is healthcare, what does it give you by way of insight? What it gives you by way of insight is nature's telling you that healthcare is a basic human right. It's not something that is an indulgence. It is not a luxury. It's a human right. So anyway, you asked the question based on small businesses. I can tell you small businesses need all the help they can get. And I hope this Congress gets together and passes another stimulus bill very shortly.
Yeah, no, great point. I think small businesses are hurt. And I think when you talk about healthcare, one of the things that's sort of left out, and this is a place where, again, I'll springboard, Riaz Saab, from your idea into bringing Irfana and Daya's work in, is that mental health is something that we're not talking about. COVID is an upper respiratory disease, or it's impacting neurology, or it's impacting this and that. And we just heard from Dr. Iqbal that it's having other issues, like we're diagnosing cancer, we're diagnosing cancers later. But Irfana, what I was surprised to hear about from Nabila was that Daya has had an uptick in activity. And I'd love your thoughts on how that's happened.
Yeah, so I want to kind of, go back to when the lockdown first started. There was a lot of anxiety around it. What's going to happen? People were out, hoarding things, buying copious amounts of food, toilet paper. After a few weeks, it was like, okay, this is okay. We're with our family. We're safe at home. People are like coming up with fun activities to do. And there was a sense that we can get through this together. But what we were seeing is that for those that were already experiencing some sort of violence or abuse in their relationships or at home, they were now basically locked up with their abuser. Basically, to the abuser to continue tightening their power and control and make sure that their victim stays at the house and they can surveil them and all of that. And so there was an increase in isolation. People are not able to leave their homes. They're not able to make phone calls without being watched. And so for many, they became extra vulnerable in that situation. Now, many of the domestic violence agencies in the area, they did report that there was an uptick within a month of the pandemic, a 40% increase with of calls and cases. And this is in the greater Houston area. And with that, one of the major requests that they were having is that they needed access to shelter. Now with the lockdown and limited beds as it already is, there's always a capacity with all of the area shelters. Where are they going to go, right? How are we going to help them be safe in that situation when we're not supposed to be going out and, maybe the shelters were in lockdown, they were not allowing new people to come into the shelter. And so, with the pandemic, we saw a different type of society, a different situation we'd never experienced, right? And we saw this virus as this, we call it a pandemic. But what it highlights for us and for society is that the domestic violence and sexual violence is an ongoing pandemic that doesn't have an end. And it really highlighted that there was copious amounts of media attention on this, showing how people live with this type of pandemic day to day, week to week, year on year for a huge part of their life. And so at Daya, for the South Asian community, we already knew the barriers. We already know the vulnerabilities. And so what we saw were that when we were getting calls after a month a month into the pandemic, people reported higher forms of violence than they were reporting earlier. They were also showing that they needed a lot more emergency needs than they normally would, right? They were in a crisis mode, and we saw an uptake of a 50% increase in call volume since March to this date. We've been in this pandemic for 6 months, and we don't know when it's going to end, right? We as an organization have started working remotely. We didn't stop providing the services. We went remotely. We continued our sessions. We kept in touch with our clients, and we actually tried to provide means that they could stay in touch with us. So, for example, we distributed cell phones to all of our existing clients, and any new clients that were coming on, we were trying to figure out ways that we could get the cell phones to them. And then we were really fortunate that we live in a city where there is a coordinated community response around domestic violence. So the mayor of Houston, all of the local agencies, local businesses, local foundations, they all got together and they started a campaign called No COVID Abuse. And it's actually a website that is functioning with the resources on it, nocovidabuse.org. And basically what that did was to show a message of solidarity and strength in coordinating response to this pandemic and the ongoing pandemic of domestic violence, and local where the survivors who are fleeing can actually have a safe place to stay the night or 2 nights or however long they needed that. And we had many of our clients actually go and use hotel space, which is amazing that we were able to do that and respond in such a quick way. And a lot of funding was distributed, and we were able to tap into that funding through our partnerships and really bring that access to the South Asian community, right? So we did a lot of advocacy. We became kind of intermediary between the larger coordinated response and our immigrant South Asian community. And then, as at Daya, we're also very fortunate to have a team that we really focus on mental health as a team and as an organization. And so during the summer, we actually did a few discussions and panels like this where we brought in South Asian psychologists and psychiatrists to talk about the vulnerabilities, the pressure of the pandemic on South Asian community. And I was kind of thinking about, okay, what is the larger impact of mental health and mental illness in the community or in the United States? And I went to the CDC website, and they said that there was a survey that was done, and they collected it by the end of June, that 40% of adults in the United States reported that the pandemic has definitely impacted their mental health, or there's been an increase in substance abuse. And so that really shows that, that the isolation, the lack of going access to a professional where you can make an appointment, go in person and see them, not being able to talk about, what you're feeling has really kind of increased and made people more vulnerable to anxiety, depression, and maybe suicidal thoughts. And so the longer this pandemic continues, we're going to see as a community, not just the South Asian, but the whole collective community, in another year, there are going to be very high rates of mental illness cases, many that are going to go undetected, unreported, and it is going to be a pandemic too, an ongoing silent pandemic that's going to continue on in the United States. I know I've been taking up a lot of time, but I want to let anyone else chime in. And Dr. Iqbal, if you want to talk a little bit more, that type of stuff with.
You have given a very good overview of what exactly happening. What I'm seeing in my practice is when a patient comes, when I give them a diagnosis, there is a hand holding, there's a hug, there is a sitting together in close proximity and letting people know you're not alone. That's gone. So what I've been doing is I ask all my patients also, do you feel the connection? If not, what can I do so that you feel that there is a connection? And a lot of people have told me that it's the connection is now coming through eyes and through the body language. So we must learn the new language of empathy now that we cannot, physically touch each other. We can't, as a society, survive without compassion and empathy. So Irfana, what you are saying is so true, that domestic violence is not caused by pandemic. Pandemic took the veil off and it's enhanced. Healthcare disparities are not caused by pandemic, but it was already there. It's just enhanced and the veil has been lifted off. So what we are seeing in these telehealth visits is we are seeing that anxiety and the lack of connection. I think what has happened again is using our professions as our platforms to enhance our awareness of human trafficking, of domestic abuse, sexual abuse, financial abuse, because there is so many layers to this that one discussion is not. Even physicians, there are increased incidence of depression and feeling isolated and feeling overwhelmed and not knowing how to express your overwhelm to your family, and fear of spreading the virus to your family when you come home from your front lines. And there are some physicians who have actually committed suicide. We all have lost our colleagues to this pandemic. So this is where, Sonny, what you are saying, and this is where that the healer comes in. I think all of us are healer at a different level, whether we are fixing a civic, wound or a soul isolation. That's where these connections are going to come, and they are not going to come from a pill, or they're going to come from a holistic approach of a community to put together. I cannot just, I think it's so important to emphasize that if not now, then I don't know when. I think everybody needs to get up and vote and fill the census and make your voice heard. When you go to your physicians, if you don't speak English, there are interpreters that they can provide. You can always ask somebody to be on the phone. If you cannot take your family with you, then FaceTime, use technology if you have an access, or just a phone call. So don't not get what you need to get because of this. Use all the technology and use, I think, the community at large. I've seen amazing stories where I've seen people die alone in the hospitals because their family couldn't be there. That's just like one and two to the Qawwali that you have created. One, to lose somebody and then not know. And so I've seen nurses and physicians hold their smartphones, and let the families communicate through that. I have been on some of those calls, and it's very traumatic. You come home empty. And so you need a Qawwali that night. You need something to uplift your soul that night. We need to make a difference, and this is the time.
I love that you have this interconnected spirit. And Nabila, I feel like I'm starting to understand why you were a fangirl. I might be a fanboy. I mean, Dr. Iqbal, you're sort of, tying in so many disparate things, and I think that's so important. And also, I think, going back to Irfana, I wish we had 45 minutes for the work Daya does, because it's so important and so underspoken about within our community. So again, thank you for the work that you do. Nabila, you may have something to say.
Yeah, well, thank you for seriously the work that our frontline workers are doing, and Dr. Iqbal, you're doing. I think what we struggle as organizers that are in this civic engagement space is trying to translate the work that we're pushing our communities to do to the lived realities of their own experiences, everyday experiences. And so I think this panel really illuminates that in a way that perhaps me saying it's your civic duty to vote doesn't, right? There is an intersectionality amongst the work that all of us are doing. And I think what happens is, what I take away from this is the system is working exactly the way it's supposed to. And what I mean by that, there are people in this country that do not have the same access to the pursuit of health, liberty, and pursuit of happiness that every American has. We just don't. And what we see is that when you get a crisis like the pandemic, it hits certain communities harder. Those communities are the ones that are the most vulnerable. They're oftentimes people of color. They're people that come from low-income backgrounds. They're immigrants, like many of the people that are on this call, and they get hit hard. And that's the way the system was made, to do exactly that. And if we want to see a change, and if we want to see something where 200,000 people dying is not happening, because right now we're on a trajectory of hitting 400,000 deaths by January, then what we need to do is change the people that are in the system so that they allow these things to change. And how do we do that? Well, we have one way. We have the vote, which is really important. And I'm going to quickly plug in the census because it's been extended into October. We're going to hope it's going to be extended until October 31st. Still tied up in court, but the census is so important because that's accessible to not just citizens, but to refugees, to the undocumented, to the immigrant, to the green card holder, to the young, to the old, to everybody. And when folks don't vote, when folks don't respond to the census, what happens? Funding doesn't get to those communities. The hospitals that need to be built don't get built in those communities. The transportation systems that people that do not have access to a lot of wealth need are not built. The folks that are voting are getting what they need done. The folks that are not voting are not, their concerns are not being responded to. And so thank you to all the other panelists, because I think what we see is what the real world ramifications are when entire communities are not taking part in the political system and making sure that that system works for them and works for everyone.
Yeah, great. And I think you went into something that I was hoping that we could go into, which is, what can we really do? We're coming from different spaces, but we're all feeling it at home in different ways. And I know Emgage does this, trying to find this intersectionality of, okay, you're coming from different places. Let's charge ahead. I think the other perspective here worth bringing in would be OCA's perspective. Coleen, I'd love to understand what are the resources that South Asians can pick upon right now during these trying times so their voice can be heard.
So one way to better reach these different communities is to have materials in different languages. OCA is always advocates for translated materials to share with the community. It's important to have a network of volunteers that can help with translations, as well as a list of resources that can be shared through social media and hard copies. We are currently reaching people through multiple phone banking events, and we are also literally going door to door to distribute literature in different languages to encourage people to register to vote and to fill out the census.
Again, so important, because I feel like, Nabila touched on this, which is we need to have our voices heard. And again, you've heard it from every panelist on this, and I'm so honored that all these cool people were able to sit with me for an hour. But, they all don't share one perspective. They may not all share one vote or type of, ballot that they're going to vote for. But I think the point is we need to exercise our voice, and that's so important. As an artist, I can tell you that I've spoken to other artists that are so gung-ho about the process, about these issues, and then that November day comes, and I have a concert here, or I have to travel to Europe because I am playing here, or this is coming up, or my grant is due, and we don't make time for it. And I've seen a lot of the artist community be really in a difficult position. And what it's making us all do collectively is say, well, I need to get out there. Before I didn't take it seriously, but now I do. There is, for many arts communities, a sort of a double whammy. One, the pandemic has made sure that we don't have work because concerts aren't happening. We understand that. Nobody wants to get infected at this point. But the other problem, and this is happening across Texas, is that the arts organizations are on the brinks of collapse. They're not bringing in revenue. They have a lot of debt. And it's unfortunate, it's heartbreaking to me, because I have some contacts in performing arts centers who are saying, I don't know. I don't know what happens at the end of the year. I don't know if I have a job. I hope you can come play like we were supposed to have you play in April, but I don't know, or May or June. So, by all means, if anything we can take out of today is, Dr. Iqbal's point, which is we're all connected. And then Nabila Riaz's point that we need to exercise that. And we should be honored as Houstonians to have organizations like Daya doing their work in the background, so we can stay healthy, but also on the front end, like OCA and Emgage, that are getting our voice heard. American Pakistan Foundation is trying to get a sectionality of South Asians there. And, I'm so appreciative of everybody's, voice here. As we come to the close of this, I'd love to open it up to the floor if we have any concluding thoughts. But thank you so much for allowing my 4 or 5 minute Qawwali to spring into a dynamic and robust conversation. So if anybody has closing thoughts, please.
Sonny, you're doing amazing work. There are times that as all of us, we are feeling empty. And it's the sounds of the words and the lyrics and the centuries of wisdom in those words that fills our souls. So keep doing the good work, and the good times are going to come. We must end every conversation on the note of hope. We must have hope, because without that, we are not human. So we must have hope.
Beautiful.
And I was going to say that, with the arts, yeah, it does get kind of prioritized at the very bottom, but really for trauma and for pain and loss, that is the conduit for healing, for feeling, for expressing. And so it's something that we advocate for our clients who have this deep trauma of violence and abuse. Many of them do turn to the arts, whether it's drawing or painting or skill, or music or dance. We had this amazing client who channeled all of that into supporting the arts and becoming this amazing dancer and getting awards. And she's a huge advocate of the work that we do. But really, it is like, Sonny, your music really is that, right? It's a way of not just connecting to our inner spirit, but to heal our spirit and to keep it resilient. So thank you so much for bringing that into this collective trauma and pain that we're all feeling. And I'm really honored to be part of this panel and to be able to share a few words about what we do as an organization.
Well, that's so sweet. I'll have to pass on all the good compliments that we're recording, so I can send it to all the other Riaz musicians. That's so kind of both of you.
I just wanted to make one quick comment that it's so overwhelming hearing about all of this. There's so much anxiety out there. People are suffering. And I think that we can't lose sight of the fact that even despite all of that, all of us have so much power. And we have to use that power and not lose hope. What Uzma was talking about. And how do we exercise that power? How do we exert that power? We exert it at the voting booth. And that's really important to remember. Oh, and we have our slides up. So I am going to very quickly, because it is something we wanted to tie in. And thank you, Sonny, for letting me put up the slide, because I do want to make sure we get that important info out. Voter registration is coming up. The deadline to vote in Texas is on October 5th. Send it in tomorrow. October 5th is Monday. It's a receive date. So if you haven't registered to vote, go to votetexas.gov and register as quickly as you can. Early voting, I'm sorry, there's a mix-up. I did this slide wrong. It's October 13th to October 30th, not October 23rd. So October 13th to October 30th is early voting. You can also vote by mail. The deadline for that is October 23rd. And vote by mail, once you get the ballot, so first you apply, when they send the ballot, you complete that. That needs to be turned in by November 3rd. And election day, of course, is November 3rd. Very important. We hope all of you will go out and vote. I think there's one more slide about the census. And yes, the census, my2020census.gov, that portal is open. We are hoping it's going to stay open. The response rates have been low for people that need it the most. And it has been one of the challenges of the pandemic. So we've got some extra time. If there's anyone that you know that hasn't completed it, please do. This is the pipeline that allows funding to come to the communities that need it the most. So thank you. My2020census.gov.
Thank you, Nabila. And I think it's so important that we try to activate our voices. Riaz Sab and Coleen, any last thoughts?
It's been an honor to be a part of this panel as a young voter. It's my second time voting in the United States. I'm leaving this conversation more informed, more empowered, and with a bigger sense of purpose to really go out and vote on election day.
And I would just encourage everybody who is watching, listening, and of course the participants as well to listen to this Qawwali, because it is an amazing composition, a great rendition, tells a great narrative, and I think you will walk away understanding the poignancy of the moment, but also you'll walk away inspired. So thank you again for that contribution, Sonny, and thank you for allowing me to be part of this very, very accomplished panel.
Well, it's a pleasure that we were able to get all of you together. Riaz Sab, you really lifted up the conversation with, going into Kun Fayakun and the lyrics. And I think, that really set us up for a wonderful conversation. I have to thank everyone on here for, the work that they do, but also allowing the arts to sort of add another color to the dimensions that we all are facing today and working with. Before we end this, I think there are two other people from OCA that I'd like to thank that are not on the screen, Maria and Debbie, who have been part and parcel from day one, and all the logistics and the cool things that you're seeing on screen is not done by us. We're just enjoying and talking to each other, but Maria's handling it on the background. So, thank you very much for everyone on screen and off screen. The dates that Nabila put up are so important. And as a artist, our perspective is that we are all connected. Riaz Qawwali's music has been to showcase why Amir Khusro or Baba Bulle Shah or Ganja Shakar, these old poets, why are they relevant to somebody in Houston, Texas? In Harris County, why do you care about what someone wrote, 800 years ago? Well, it's relevant because it sort of transcends, the bounds of time. And, Riaz Sahib said that so well. And Dr. Iqbal, continued to hammer this point in, which, I'm going to now steal, copy and paste and say we are connected. This is not a virus that's just hurting us in the hospital square footage. It's hurting us mentally. It's impacting our families. And now it's turned, unfortunately, political. Again, without going into where you believe and why you believe, there is science. And if you believe that we need to act in that regards, I'd love for more of us to come out in the beginning of November and showcase that this is what we stand for. Thank you very much to all of you. And I will say that this is part one. We are excited about doing another Qawwali and hopefully bringing all these wonderful, beautiful faces back on a panel. So again, thank you very much for joining and look forward to catching you guys within a couple of weeks.
Thank you.
Bye, everyone.
Bye.
Have a good night. Thank you.
Bye.